Why do I have to fill this out again? Oh, it's just to say that you are the legal father of the child. You don't think I'm the father of the child? No, I didn't say that. It's just, we have everyone do it. I didn't see you make her do it. You mean the woman who just gave birth to the baby? Yeah. How come she doesn't have to sign anything that says she's the mother of the baby? Well, I'd say because pushing a baby out of your uterus in a room full of people is all the proof we need. Are you giving me attitude right now? Because I'm not having this. So the only thing you're not gonna have is custody of this child if you don't sign those papers. Let me get this straight. You're saying that I have to sign this paper to say I'm the legal father of this child. Yes. And you're saying that she doesn't have to sign any papers to be the legal mother of this child. Correct. And your reasoning behind that is because you saw her give birth? Yes, exactly. Anyone could be the father of this child, only she could be the mother. That's why we need you to sign these papers. How does that make sense to anybody? You know what? You're right. Maybe it's best you don't sign this. For the baby's sake. Hello, sir. How can I... Oh my God. Sir? It's poop. What?
Don't worry, I'm a farmer. I just didn't want to be late.
Oh, so that's cow poop.
The cow poop? Ew, that's disgusting, no.
Then what is it?
It's me. I poop my pants.
Okay. Red flag. Is that normal for you?
No! I just didn't want to be late to my chemo appointment. My farm's already 3 hours away. If I stopped to use the bathroom, I would have been late.
So you pooped in your car? While driving?
Yeah, I didn't want to be late. That's rude.
How is this better?
You'd rather I be late to my appointment?
Sir, being 10 minutes late is always better than showing up in your own poop.
Jeez, okay. I'll know for next time.
Hi, I need assistance in room 4. He has a chemo appointment, but he's gonna be late.
You're making a big deal out of nothing. It's just poop.
Fecal matter is in fact a biohazard, sir.
Ugh. Clorox? Oh shoot, sir, I don't think I was supposed to wipe you with these.
New nurses, they can be a handful.
Call a code! What color? Clit, clit, clit.
Okay, that's not helping. You gotta watch them like a hawk. Do not let them out of your sight. What should I do if someone is shivering?
If someone is shivering, it usually means they're cold.
Oh, then let's get them a blanket. Try to hold still, sir. They're having a seizure. I blame ChatGPT. Hey, how do you turn off this big beeping machine in room 2? That's a vent for our intubated patient. That doesn't turn off. It's the only thing keeping him alive. Hey, how much longer is this gonna be? Unfortunately, sir, the wait time is still a little hard to predict. So you still don't know? I still don't know. You see this? Yes, that's your urine sample.
Yeah.
What? Why would you do that? Why not if you're just gonna make me wait here and not use it? Sir, we need that sample for a test. Without it, all this waiting was for nothing. What? I guess I didn't think that through. I can see that. I guess I should go drink some more fluids then, huh? Well, why don't you just point me to the direction of the cafeteria? That way. Thank you. That was weird, huh? Oh no, that's just Mr. Jenkins. He does that all the time. Huh. Is anyone gonna come send me on break?
Code blue, OR, room
Shoot.
3, code...
What the hell is going on? Steve, help! Who is on the OR table? It's Lexi. Lexi who? Nurse Lexi. She was supposed to send me on break 20 minutes ago. Why is she unconscious? And why's your pants down? We were having sex and things got escalated. What does that mean? She asked for lube and I grabbed this jelly. You grabbed lidocaine jelly? I didn't know it had lidocaine in it when I grabbed it. You used an anesthetic as vaginal lube and anal lube. Oh my god. She said she wanted to try something new. Paralyzing her colon from the inside out is definitely something new. Will you just make sure she's breathing? I can't feel my pee. I'm supposed to be on break. Lexi, wake up. 26-year-old female found unresponsive after MD Kevin allegedly used lidocaine jelly during an unsanctioned sexual encounter in unused OR. Do you really have to use my name? How's your BB? Still numb. Serves you right. I don't know who trained you, but that's not how I want it done. You flushed before the draw? Why would you do that? I thought, don't think, just follow orders. Now we have to redraw everything because you couldn't listen. This is basic, basic. If you can't handle that, maybe you shouldn't be a...
Okay, that's enough.
I'm speaking to her.
You're speaking at her and you can stop now. You're upset about a saline flash. It compromises the labs. No, it ensures the line is patent and working before we draw. And we need a working line to draw blood, right?
Yes, but...
And we waste the first few mLs so it doesn't affect the results. We have that process perfected so it seems like it didn't happen at all. Do you waste before you draw labs?
Well, no. But...
So you're telling me that the saline and possibly medications that are sitting in that unflushed line mix with that first tube of blood you draw?
Maybe, but...
And that mixture can ultimately alter labs way worse than what you were just yelling at my new nurse for?
Well, that's not how I was taught in med school.
So you were taught a bad practice in med school and somehow that makes it okay? Tell me, how many patients did you wrongfully treat based on diluted results?
Just next time, make sure you follow the doctor's orders.
And if those orders are wrong?
Question them.
That's what I thought. Make sure your argument makes sense before you get all bent out of shape. Have a good day, doctor. Good work. You asked, you listened, you did it right. That's what a good nurse does. First rule of this job, if it doesn't make sense, question it. Second rule, no one gets to learn by being humiliated. Unless you bring those weird jelly donuts from the corner store. Those are disgusting. But besides that, you're safe here. Now drink this before it gets cold, and file a complaint about that doctor. He will not be raising his voice like that again. That part's in order.
Silvio, what did I say about playing with your catheter?
It's irritating me. Take it out.
It's helping you go to the bathroom. Look, it's collecting urine in that bag.
I could pee myself in the bathroom.
You've had a fall. You can't get out of bed. Now leave the catheter alone.
I don't want it inside of me.
Silvio, no. If you accidentally pull out that Foley, it's gonna hurt a lot.
Are you saying I can't take pain? I'm from the east side.
East side, west side, it doesn't matter. An inflated balloon ripping through your urethra would take anyone down.
Hi, you pressed the call button. How can I help you? Yeah, I'm gonna need something for the pain.
What do we got?
42-year-old male, possible concussion, broken foot, ruptured eardrum, and fluid in the lungs. Classic case of a lemonade sale gone wrong.
How did a lemonade sale lead to all that?
Well, our patient had a problem with some kids selling lemonade in the neighborhood. He thought it was $1, then after he drank it, they said it was 10.
Those kids are crooks.
They started arguing, and I guess one of the kids pointed out his bald spot, so he got mad and tore up their sign.
I don't have a bald spot.
Anyway, the mom came out and smacked him in the ear, causing it to bleed.
So that's the ruptured eardrum.
Then he got really pissed and tried to kick over the lemonade stand, not realizing he was being held up with concrete blocks.
And there's the broken foot.
Right. And then everyone started pointing at him and laughing, so he took their pitcher of lemonade and tried to chug it, I guess.
Why would he do that? To get my money's worth.
Well, it was too much liquid, so he started choking.
Fluid in the lungs, got it.
And then he fell down and hit his head, leading to the concussion.
Huh, I guess you're right. Classic case of lemonade sale gone wrong.
Told you.
No one told me that eating 6 Tide Pods would give me uncontrollable diarrhea.
Sir, we're gonna have to keep you at the hospital.
I've already been in for 9 hours.
I know, but...
Ben, can I speak to you?
Okay, be right there.
Hey, I still need help! Ben, why did you discharge Mr. Isaac in room 3 without ordering a CT scan?
Because he didn't need a CT scan.
He came in for a broken bone.
And the x-ray confirmed that.
You can never be too sure. An extra CT scan would have been more definite.
Did you see the x-ray? We successfully reduced it back into place and he's following up with ortho.
Yes, but then we can't opt for higher reimbursements.
So just to be clear, this month you've denied my pay bump approval, you've declined my request for time off, and now you want me to opt for a line of care for my patients that will maximize profits?
We like to say align proper care with the hospital's vision to prioritize profits. Patients.
There are not enough beds or staff here to keep patients for unnecessary tests. I am doing the best I can with the limited resources you have provided me with.
Ben, you're needed in room 263.
I'm needed everywhere because there's not enough of me.
This is what you signed up for.
No, I didn't sign up for this. I can't take this anymore. I'm done. Gotta go somewhere. I need to laugh.
Oh my God, you have to go to the steveioe Not Your Hero comedy tour.
The what?
According to your symptoms, upset stomach, anxiety, depression, high blood pressure, oily skin.
Okay, that's enough symptoms.
You may need a dose of comedy, or at least relatability. Ooh, sounds exciting. Am I invited?
Hold on, let me get my glasses on so I can see it. What is that? Oh, it's a bitch!
Tips from the ER. Urine samples. People, listen to me. When we ask you for a urine sample, we are not trying to get you in trouble. Our priority is not to send you to jail. Our priority is to make sure you don't die. We need to know what is in your system in order to take care of you. In particular, if you have abdominal pain, the test will tell us whether or not it is a UTI, which it probably is. Stop lying to us about what drugs you've taken. We could tell. How? Because this is our job. We see this shit every day, 24/7. If it's meth, we have to hydrate you. If it's cocaine, we have to make sure your heart doesn't explode. If it's THC, we will leave you the fuck alone. Maybe get you a snack. If we suspect that you are drunk and you tell us you've had 1 drink, we assume 3. You say 2, we say 6. We multiply by 3 because you motherfuckers are liars. It makes our job so much harder and it puts you at risk. Why do you hate yourself? Learn to work with us so we can get you the fuck out of the ER, which, trust me, is what we all want. Tips from the ER. HIPAA, or the Health Insurance Portability and Accountability Act, but nobody calls it that. Ask any healthcare worker, they'd be lucky to get 3 out of 5 of those words. HIPAA is the reason we can't tell anybody about your naughty healthcare business without your knowledge or consent. If you accidentally get a condom stuck in you cheating on your wife or husband, don't you worry, your secret's safe with us. We're not going to tell them anything without your permission because of HIPAA. We will talk about it in the break room though, but we won't post it on social media. If your loved one was in an accident and you call the ER to check up on them, we're not going to tell you a damn thing over the phone because we have no fucking clue if you are who you say you are. We might tell you whether or not they're dying, but besides that, our lips are sealed. Don't be mad at us. Be mad at HIPAA. It's a reason so many healthcare workers get fired. You really want to know the craziest thing I've ever seen in the ER? I can't tell you motherfuckers because of HIPAA.
I'm getting Starbucks. What do you want? I'm in line. What do you want? I'm about to order. What do you want? Hello? Starbucks. Can you get me like a venti? I already got it. Go back and get it! Where have you been?
Okay, sir, I'm back. How did those eardrops work out? My earache feels better, but the medicine tasted awful. The eardrops tasted awful? Mm-hmm. But your ears are feeling better? Yeah. Well, as long as you're feeling better, that's all that matters. Hello, welcome to the ER. How can I help you? My boyfriend here is having a really bad stomach ache. It doesn't look too good. Can you tell me when it started? A few hours ago. I think it's because he drank his own urine. Why did he do that? He read online that urine therapy is the antidote for COVID. What? You didn't know that? Did he have COVID? No. I'll be right back. Where are you going? To quit my job. Tips from the ER. The Q word. Medical workers in the ER are very superstitious and are most triggered by the Q word. If you come into the ER and it's a little eerie because we have no patients and everyone is calmly sitting, don't you dare comment on it. Specifically, don't say the Q word! Ask anyone in the ER and they'll tell you it's a proven fact that saying the Q word is a green light for anarchy and disorder to descend upon the ER and wreak havoc. It's gonna get busy and it's gonna be your fault. Don't believe me? Get this. Someone said the Q word once and I saw 5 ambulances, 10 patients, and a tsunami show up to the emergency room. Facts. So next time you're in the ER, if you don't want us to hate you, don't say it's quiet. Motherfucker. Tips from the ER. Code Blue. Ah, yes. If your daily caffeine intake hasn't woken you up yet, a Code Blue certainly will. If you ever hear this over the loudspeakers of a hospital, it means someone somewhere has either stopped breathing or their heart stopped working. Hopefully it isn't you. But if it is, don't you worry. A team of doctors, nurses, respiratory therapists, and whoever else can get their pants on will rush to come find you and bring you back to life. And just like the TV shows, they will run, and fast. So if anyone's in the hallways, get out of the way. Hearing Code Blue in the hallways is like hearing sirens on the streets. Pull to the motherfucking right! I have no idea why they call it a Code Blue. If I had to guess, it might be because the person turns blue when they stop breathing or when they're dead. Wouldn't want that to be you. Code Blue! Tips from the ER. ETOH stands for ethanol or ethyl alcohol. If we say a patient is ETOH, it means they are drunk as fuck. Yo, I'm back. What did I miss? You got a new patient in bed too. ETOH. Nice. What's the alcohol level? Don't know yet. Just set the labs down. He did piss himself though. Damn. Come on, I'll help you change him. Thanks, motherfucker. You're welcome, motherfucker.
Is there a doctor on board? That should have been you. Dad, not now. They're not asking for a TikToker to help, are they? Dad, there's a medical emergency happening right now. Go and see if that TikTok dance helps. Please, can anyone help this man? He's losing a lot of blood. There's this new trend on TikTok that I saw that might help. Sit the fuck down. Okay, fucking bitch.
Tips from the ER. Shocking. Did you know that when we shock a patient, it's not because their heart has completely stopped working? As a matter of fact, you would never shock a heart that's flatlined. Those silly medical TV shows always trying to shock a dead heart back to life. Cut that out, Meredith. Get back to CPR. A shock to the heart is used when the heart is beating irregularly, aka when it's in fibrillation. We gotta defibrillate it. Guess what AED stands for? Automated External Defibrillator. What? We gotta shock it back to normal. A heart in fibrillation is like a kid who won't stop jumping around. Sometimes it needs a little external stimuli to keep it in check. I'm just kidding. Please don't shock your kids. I've seen patients wide awake get shocked because their heart wouldn't stop acting funny. Painful to watch, but it saved their life. Shocking. Alright, what do we got? Unidentified female walking around half naked and talking to herself in front of the 7-Eleven on 5th and Broadway. We're not sure who called it in, but we're guessing it was the guys at 7-Eleven. Anything wrong with her? Nah, she was just scaring away the customers. And then it went, I didn't. Okay. She has some stuff in these garbage bags, but we're not sure where her pants are. What is that cord under her? Cord? Oh, that's definitely not under her. Whoa, that's coming out of her hoo-ha! Oh. Hey, I have one of those. That's an Android charger. Do you need another one? No. She didn't even flinch. Hey, you think maybe she was just trying to, recharge? Whoa! Good one. Hey, Rich, do you have a phone charger? iPhone or Android? iPhone. Ah, darn. I only have an Android charger. Damn, what's with these Androids? You and Austin. Austin has an Android? Yeah. Really? Where is he? Hello, my name is Rich. What brought you into the ER today? I have a stomach ache, and I've been throwing up all morning. I'm so sorry to hear that. We're gonna get you back right now and get you some nausea medication, okay? Can we wait for my mom? She's parking the car. Oh my goodness, there you are. Hi sir, I'm Mom. You're just in time. We're about to bring him back. I brought his vomit in case you need to see it. What? Oh my god. Do you need to see it? No, please throw it away. Well, shouldn't you show it to the doctor at least? No, they don't want to see it. What should I do with it then? Throw it away! Help! Well then why did I bring it all the way over here? I don't know! Help! I want someone to see it! Fine! Yo, Austin, what are you doing? Can you help in triage too? Sure thing, I'll be right there. You bitch. Tips from the ER. HIPAA. Or the Health Insurance Portability and Accountability Act, but nobody calls it that. Ask any healthcare worker, they'd be lucky to get 3 out of 5 of those words. HIPAA's the reason we can't tell anybody about your naughty healthcare business without your knowledge or consent. If you accidentally get a condom stuck in you cheating on your wife or husband, don't you worry, your secret's safe with us. We're not going to tell them anything without your permission because of HIPAA. We will talk about it in the break room though, but we won't post it on social media. If your loved one was in an accident and you call the ER to check up on them, we're not going to tell you a damn thing over the phone because we have no fucking clue if you are who you say you are. We might tell you whether or not they're dying, but besides that, our lips are sealed. Don't be mad at us. Be mad at HIPAA. It's a reason so many healthcare workers get fired. You really want to know the craziest thing I've ever seen in the ER? I can't tell you, motherfuckers, because of HIPAA. You're just going to have to wait till I get fired, which at this rate seems pretty soon. Tips from the ER. Free things you could ask for in the emergency room. Antibiotic ointments, individual packets, and sometimes the whole tube. Wound care supplies, gauze, tapes, dressings, band-aids, wraps. You can never have too much. Take a whole bag home with you. Clothes. Now it varies from hospital to hospital. If you're lucky, you can get a fresh pair of sweats. But no matter where you go, you can always get hospital socks. How about some toiletries? Toothbrush, toothpaste, lotions, shampoos, soaps, combs, earplugs, we got it all. And of course, feminine products, pads, and mesh undies. Ooh, so soft. Hello, welcome to the ER. How can I help you? I'm having really bad contractions. I'm so sorry to hear that. Oh my god, you are going into labor right now. We have to get you upstairs. No, that's impossible. I can't be going into labor yet. What? Why not? I have an app that's tracking my pregnancy. It says I'm not ready yet. An app, ma'am? I can see the head of your baby from here. Are you sure it's not something else? The app says I should have another 4 days. No, it's your baby. But the app. Can I see the app? Yeah? Yeah! Tips from the ER. New York nurses on strike. Do you remember during the pandemic when hospitals were overwhelmed with patients and there just wasn't enough resources to keep people alive? But nurses were hailed as heroes to guilt trip them into not quitting these dangerous working conditions. Oh, please come back and risk your license for us. You'll be a hero. Well, you fucked around long enough and this is what you found out. Over 7,000 nurses in New York have walked off the job to protest current dangerous working conditions, like having to take care of twice as many patients as they normally would with the resources of a fourth world country because hospitals won't hire more nurses. That is insane! I mean, come on! Your dumbass can barely take care of your one child at home without having a mental breakdown every 2 minutes. How do you think one ER nurse is supposed to keep more than 10 sick people alive at the same time? These nurses are completely burnt out, and the last 2 years have traumatized most of them into quitting and starting an OnlyFans. Because if you're gonna get fucked, you might as well get paid correctly for it. Sir, the doctor is done evaluating you. There's nothing more we can do. I'm not ready to go yet. He didn't even do anything. We've ruled out anything emergent. You're gonna have to follow up with your primary care doctor. I'm sorry. Here are your discharge papers. Man, shut up, you stupid chink. Fuck these papers. Get me some medicine. Sir, are you gonna leave or am I gonna have to call security? Ugh. Hey, have you seen security? No, what's up? This guy in room 2 refuses to leave, and he just called me a chink. Whoa, not cool. Okay, stand by. I'll find security. Cool, thanks. Okay, sir, security's on their way. Oh, look who's back from China like COVID. Seriously? Sir, that is enough. It is time for you to go. Psh. You will not speak to anybody at this hospital like that. Do you understand me? Now kindly pick up your stuff and leave. Thanks, Austin. Sorry I couldn't find security. I don't think we needed them. I got your back, Ben. Hello, my name is Rich. What brought you into the ER today? I have a stomach ache, and I've been throwing up all morning. I'm so sorry to hear that. We're gonna get you back right now and get you some nausea medication, okay? Can we wait for my mom? She's parking the car. Oh my goodness, there you are. Hi, sir. I'm Mom. You're just in time. We're about to bring him back. I brought his vomit in case you need to see it. What? Oh my god. Do you need to see it? No, please throw it away. Well, shouldn't you show it to the doctor at least? No, they don't want to see it. What should I do with it then? Throw it away! Help! Well then why did I bring it all the way over here? I don't know! Help! I want someone to see it! Fine! Yo, Austin, what are you doing? Can you help in triage too? Sure thing, I'll be right there. You bitch. Hello, my name is Rich. What brought you guys into the ER today? My wife is having a lot of pain in her stomach. Help me. It looks like you have some fluid in your abdomen. Wait here, I'm gonna have the doctor come out to ultrasound your belly. Honey, it hurts. It's gonna be okay, baby. I'm here. Doctor, do you see anything? The ultrasound looks like you ruptured an ovarian cyst. I freaking knew it! Yes! High five. Or not. Ah! But how did this happen? Have you had sexual intercourse recently? Yes? When? It was about 30 minutes before all this started happening. Okay, so this makes sense. What likely happened is that your husband's penis hit the ovary during intercourse, causing the cyst to rupture. Oh, that's not possible. Why not? My husband, he's quite small. There's no way he could reach that far to hit my ovary. Oh, shit. Is there any other reason?
No. Not likely. There is definitely no other reason. Stay strong, King. You got this. Welcome to the ER. My name is Ben. How can I help you? I have a surgery scheduled today. They told me to come to the ER. Oh yeah, I remember you. 1 second, let me check you in. Thanks. Wait, what is that? It's coffee. You're not supposed to eat or drink anything before your surgery. Relax, it's just coffee. It doesn't matter. We went over this. It's dangerous. Okay, then I'll stop. Whatever. Ah, shit. What? They're gonna cancel your surgery. What? No way! They can't cancel! I'm here! You can't have anything in your system before this surgery. That's so stupid! I bought that coffee here! Why do you even have a coffee shop if I'm not allowed to drink coffee? Because the coffee isn't just for you! Then why sell me coffee? Why would they sell me coffee if I can't drink it? What? How are they supposed to know you have a surgery? I don't know. Shouldn't you tell them? What? Tips from the ER. Lucas, the CPR robot. This is a Lucas, and it was made for healthcare providers who are struggling to perform good CPR in the back of a speeding ambulance. How's it going back there? Fantastic! Also, CPR gets exhausting! It's gonna be okay, little guy. Unlike a human that has to switch out every CPR cycle, this machine can last much longer than 2 minutes, which is more than I can say for your boyfriend. Shots fired! Now, I know this machine seems aggressive, and it looks like it's doing more harm than good. But remember, the goal of CPR is to manually beat this person's heart through their sternum! And we're gonna have to crack a few ribs to get there. Ah! Is that gonna hurt the patient? Let's ask them. Hello? Oh wait, he's dead! And he ain't getting any deader. So grab the Lucas! We got a patient to save, motherfucker! Yo, shoes came in today. Nice. Ooh! Wait, these aren't the ones I ordered. I wanted the blue ones. I got the blue ones. Ben, these are for women. Sorry, Austin. They're free hospital shoes. Sometimes the orders get mixed up. That's kind of unfair. Do you want to trade? Really? No! Ha! I'll be in triage. Hello, welcome to the ER. How can I help you? My nose won't stop bleeding and I keep throwing up. It's because you're tilting your head back. Tilt your head forward and hold your nose. Really? Yes, never tilt your head back when you have a nosebleed. Okay. Why not? Because you're gonna start drinking your own blood. It's gonna make you nauseous. That's also why you're throwing up. Oh, I didn't know that. My mom always told me to tilt my head back. Well, tell your mom she's wrong and hold your nose tighter. You're gonna get blood on my new shoes. Sonny, there you are! What are you doing? Tilt your head back like your mother told you to. Oh, okay, Mom. No, what? Dude, we just talked about this. Ma'am, he has to tilt his head forward. Forward! Oh, okay. Excuse me, how are you gonna stop the blood? Head back. Okay. No, forward! I said back! I'm getting a little nauseous. Forward! Back! Forward! Back! Back! Tilt back! Tilt back! Why do you want to trade shoes now? You know, I just think that it's so uncool that they messed up your order, and I want to be a good friend. What's that smell? What? I don't smell anything. Hey, Doc, are you gonna order CT scans on any of these patients? Which ones? How about the 65-year-old with head trauma? No, I don't think it's necessary. Okay, then what about the patient with an elevated D-dimer? They could have a blood clot. No, I don't think so. Okay, what about our stroke alert patient? She came in with classic stroke symptoms. I think she's gonna be fine. Can you just make sure to get a CT scan on the patient in room 2? Room 2? The girl who came in because she thought she was pregnant? Yeah. Her pregnancy test came back negative. She's fine. Yeah, but she vomited like 3 months ago. And she's got some pain. Pain where? Just in general. You've got to be joking. She's the only patient that you haven't even physically seen yet. Oh, no, you're right. I made a mistake. Thank you. Add contrast. No.
Okay, sir, and are you on any medications? I'm taking the Candy Satan for my high blood pressure. Do you mean Candesartan? For my high blood pressure, yes. Okay, anything else? My doctor prescribed me hydrocorn dogs in case I need it. Hydrocorn dogs? In case you need it for what? Pain? I think you mean hydrocodone. Oh yeah, that is how you say it. Is that a medication list? You could just hand me that. There's one I forgot to put on there. Tamsulosin. Tamsulosin? It's for the thing that's growing inside my butt. Excuse me? My doctor stuck his fingers in there and checked it a few weeks ago. Your prostate? Yeah! Oh, tamsulosin for an enlarged prostate. The thing that's growing inside my butt. Hello, welcome to the ER. My name is Rich. How can I help you? I think I have a funny looking blister on my foot. Ooh, I'm sorry to hear that. I'll take a look. Are you in any pain? I've been feeling some tingling in my foot, but nothing serious. Oh, wow, that is a very infected ulcer. You don't feel that? No, not really. Is it that bad? Yeah, we're gonna get you back right now. Rich, break time. Whoa, that is one infected looking ulcer. I really wish I knew what you guys were talking about. Sir, you have an infected hole in your feet. You don't feel that? No. Are you a diabetic? Yes, I am. Oh, that's why. Well, what do you mean? You have diabetic neuropathy. You've lost the ability to feel pain in your feet. Really? Have you been managing your diabetes? No, I haven't been really good at it. You need to get your diabetes under control. If you can't feel pain, you won't know when you're injured, and stuff like this will keep happening. What happens if it keeps happening? Worst comes to worst, we'll have to amputate your feet. What does that mean? It means we'll have to cut them off. That sounds horrible! Well, luckily yours isn't that bad yet. Will it grow back? What? My foot. Will it grow back? Well, would you look at that? It is my break time. Ben, you got it from here? Cool. Bye. Let's just get you back and we'll have the doctor answer any questions you might have, okay? Welcome to the ER, ma'am. My name is Ben. How can I help you? I want to get my labs checked. Okay. For what? Me and my partner have been trying to have a baby for years and nothing's working. I want my labs checked. Ma'am, this is an emergency room. You and your partner need to go speak to a fertility specialist. We can't get an appointment until next month and we need to know what's going on. She and I have tried everything. Well, wait, hold on. You said she and I have tried everything? Yes, she and I, no protection, still no pregnancy. Is you and she a female? Yes. You know two females can't get each other pregnant, right? Well, I was with a male for years before my current partner, and I still never got pregnant. So what does that mean, smart guy? It means you might not be able to get pregnant. It doesn't change the fact that you need a sperm and an egg for conception. Sperm coming from a male. Oh, this is so typical coming from you. I don't need a man in my life, okay? Goodbye. What the fuck?
কি খবর তোমাদের? কেমন আছো তোমরা সবাই? ভালো তো না? তুমি জানো তোমায় কালকে তো কতবার বলেছি।
হ্যালো, আসসালামু আলাইকুম।
ওয়ালাইকুম আসসালাম। কি রে? এদাই। তুহিন, মানা করতেছি।
ভাবি আপনি জানেন আমি একবার অসুস্থ হয়ে গেছিলাম, ও আমাকে রক্ত দেয়নি, আর আজকে আপনাকে রক্ত দিয়ে চিঠি লিখছে।
আমাকে বুকিং দিছে মানে আমাকে কে বুকিং দিছে দোস্ত?
তোর যে আশিক আছে না, এখন তো আমার পিছনে লাগছে।
এই এই দুলাভাই সামনে থাকলে যে সালাম দিতে হয়, আপনি শিখাই নাই তোরা? কেমন আছো তুমি?
ভালো।
আমাকে জিজ্ঞেস করবো না রক্তটা দিবি তুই? আমি কেন রক্ত দেবো? প্রেম খরচ তুই, রক্ত
আমার বন্ধু দিছেন আপনাকে অনেক ভালোবাসি ভাবি। আপনার ওর রক্ত যাওয়াটা বিধে হতে দিবেন না ভাবি। 073421924 এটা তোমার নম্বর না?
জি জি, আপনি কেমন আছেন?
ভালো নেই, আমি ভালো নেই। আমিও তোর মতোই ভাবতেছি, রক্ত যদি দিতে যায়, না রক্তটা আপনার কাছে এইটা আমার লাস্ট রিকোয়েস্ট ভাবি।
আচ্ছা
কখন আসবে তোদের ভাবি আর ভালো লাগতেছে না আমার। সে যে কেন এলো
আসতে বলুন না, সেটা আমার একটু জরুরি কথা আছে।
বাবা,
ভাই আমি তো এলাকা ছাড়ার আগে
তুমি একটা হীরার টুকরা ছেলে, যেই ছেলে তানিয়া আমার পিস্তলটা নিয়ে আয় তো।
কাকাকে দুধটা রাইখে গেলাম।
মাত্র সে ফেসবুকে স্ট্যাটাস দিয়েছে সে একটি অনাথ বাচ্চাকে
কত স্যাক্রিফাইস করছি, এলাকার বড় ভাই থেকে রিক্সা চালক হয়ে গেলাম, আর সেটাই করবো। যে গরম না, আর এই বড় ভাই তোর মায়ের চিকিৎসার দায়িত্ব নিছে। সেলিম ভাই ভালোবাসার লেগে জেল খাটছিল।
ভাই আপনি যত কথাই, এই বাড়িতে ওই বদমাইশটার কথা একবারও ভুলে উচ্চারণ করবা না।
ভাই মিনিমাম আপনি 17 লাইনের একটা কবিতা লেখেন। 17 লাইনের কবিতা
কিন্তু ছাপাই না, সব মাথার ভিতরে থাকে। যখন পড়তে ইচ্ছা করে মাথা, আমি জানো ওরে বাপ করে দেব। আর আমি কি কমো জানো, তবু তানিয়া ভালো কেমনে বেটা কস না কেন ক বেটা,
এটা পড়ে আপনার প্রেমে পুরো রূপ করে পড়ে যাবো। আর তো আপনি পারবেন ভাই, আপনি পারবেন।
ও 700 লাইন লিখবো, আর বাদ বাকি 300 লাইন আমি লেখা বললাম।
একটু নামিয়ে দাও, মানে ও ছাড়া পাক না পাক তাতে আমাদের কি?
বন্ধু, তুই যদি রক্ত দেস ভালো লাগে না রে দোস্ত।
না দুলা ভাই, আমি তো কোচিং এ যাই নাই, আমার তো বাসায় গেস্ট আসছে, আর আমার আম্মু তো একা, এজন্য আমি যাই না। আমার পড়াশোনা সবকিছু বন্ধ করে দিবে, তখন আমি কি করব?
আরে ছাইরা দে। ভালোবাসা যে এত প্যারা, এত কষ্ট, এত জ্বালা যন্ত্রণা, জানলে ভালোই বাসতাম। জিসান আর তুলির ভালোবাসার ইতিহাস, তাই রক্ত লাগবে দোস্ত।
আসসালামু আলাইকুম দুলা ভাই।
আরে শালা, ওয়ালাইকুম আসসালাম। কি খবর, কেমন আছো? বান্ধবীও তো যায় না, এতবার ফোন দিলাম ফোনও ধরতেছে না। তুমি একটা ফোন ধরতে, ফোন বের করো।
কি বলেন দুলা ভাই, ও যায় নাই? কথা হইছে, ভাইয়া বলছে যে ভাইয়া আমাদের কোচিং এর সামনে আর আসবে না, আর তোকে ডিস্টার্বও করবে না।
কারণ না, আমি 1 থেকে 3 গুনবো, না বাবা, প্রেম হইলেই হবে, প্রেম হইলে এমনি ডিফারেন্স হবে বাবা, আমার খালি ওরে দরকার।
রক্ত কেন?
ইতিহাস লিখবো, ভালোবাসার ইতিহাস।
ভালো আছি, আপনি ভালো আছেন?
আমি তো ভালো আছি, তো তোমার বোন কোথায়?
আচ্ছা একটা মিনিট, আমি কল দিচ্ছি।
এত রাতে ভালো হয়ে গেল, এটাও আমার বিশ্বাস করতে হবে। দোস্ত আমার না ভয় লাগছে।